On the surface, it seems like a pretty normal thing to suggest, right? Get a year-end or a yearly checkup and you'll feel better. You have an idea of how your health is. But the point being made in this new research coming out of McGill suggests something different, that yearly medication checkups could prescribe something that's called overprescribing. Dr. Emily McDonald's an associate professor of medicine at McGill, lead author of the study. Dr. McDonald, thanks so much for taking the time. Let me begin by asking, as I said, I think most people would say, yeah, go get a yearly checkup. And I understand this applies to seniors for the most part. Why isn't this as easy as it sounds?
Yeah, thanks for the question. So we have a growing problem of overprescribing in Canada. About 2/3 of older adults who are healthy and living in the community are taking 5 or more medications now. And we've seen that now we have some patients who are taking 10 or 15 or 20 medications. And so we actually need somebody to sit down who knows something about the person and their medications and their conditions and take the time to review all those medications and see if they're all still indicated and beneficial.
Yeah, I would have, even as you say that, though, I think to myself, you go for your physical, you go for your yearly, whatever it happens to be. Wouldn't your doctor already be doing this to begin with? They're the ones prescribing the medication.
So what we've observed is at annual visits, what tends to happen is that medications get re-prescribed. So we make sure that you're not missing anything, that there's no duplications, but we don't always have enough time to look at each medication and see if it's still helping you or if it's causing you symptoms. We tend to be very good at prescribing, but it's less emphasized in medical school and in undergraduate training how to de-prescribe, which is stopping medications when you no longer need them or they may no longer be beneficial.
I imagine some of that might be from the actual patient saying, no, I want to keep taking these particular medications. They don't want to stop at that point. They become accustomed to taking them.
It's interesting. There is some of that. So some medications like maybe sleeping pills or acid reflux medications are maybe the patient would like to continue those medications. They may not always know the side effects, though. And there are studies showing that if a doctor says it's safe to do so, most patients would want to stop a medication that they don't need anymore.
Okay, and I'm wondering, if I read this right, this applies more to women for some reason than men?
So women do take more medications, or they are prescribed more medications than men. That's not the case in all populations, but it has been observed in Canada. Women are prescribed more medications than men, and so are people living in nursing homes, people living in rural areas, or living further away from the city center as well.
You also make a point, I guess this is worth, when you say that 2 out of 3 people 65 and over are at least on 5 medications, right? The other part, I guess, here, if you have a complex, sort of drug regimen like that, there is risk of a side effect from just putting medications together, is there not?
Absolutely. So this is called a prescribing cascade, where you have a symptom from a medication and you get prescribed another medication to treat that symptom. Oh. And whereas we should really be taking a look to see if that medication causing the side effect is helping you and if you still need it. But rather what we do is we tend to prescribe another medication because we do have a sort of culture of a pill for every ill. So we have lots of medications to treat symptoms.
All right, so what's the advice here? There are people listening to this, I'm sure, who find themselves, taking these pills because they keep going back and they're re-prescribed. If the idea is here, be paying attention, what's the advice here?
I think it's really important to know each medication and ask what each medication does. Consider whether or not this is a medication that you're taking for prevention or it's something that helps you with a symptom to live better or live longer. And then ask your prescriber, and I emphasis on prescriber, to take a look at your medications and see if there's some that you may no longer need. That could be your pharmacist. So pharmacists also have prescribing powers now in Quebec, and so you could see a nurse practitioner, your family physician, or a pharmacist, and they are equipped to review your medication list and go over it with you and see if there's any meds that you could potentially de-prescribe.
Is part of the suggestion here as well, I kind of hate to bring it up, this way, to just push back with your doctor?
I don't think it's a matter of pushing back. I think, we've all seen that there's limited time, when you go for a visit, and there's a lot of different competing priorities with different types of screening tests for cancer and making sure that you're getting treated for osteoporosis and all of your other medical conditions. And so it's showing that you're interested in your medications and that you want to make it a priority to be on the best and right medication regimen for you. And sometimes that means stopping some medications or decreasing the dose, especially as we age.
Are there more common medications here? Like I know sleeping pills are on the top of the list, I guess, right? Are there some that are being re-prescribed more often?
Yeah, sleeping pills are definitely at the top of the list. These are meant to only be taken for about 10 days. It's not a medication that's meant to be prescribed chronically. We also have a lot of people who are taking proton pump inhibitors, which are prescribed to treat acid reflux. Again, those are meant to be taken for many people just short term for a couple of weeks, but we see some people taking them for years. We have other people who are taking multiple daily doses of vitamins that they could reduce to maybe once a day or a couple times a week. We have older adults who are taking antipsychotics to treat symptoms of dementia when that's not really the first line treatment for those symptoms. So those would be some common ones.
By the way, when you just said that, now I thought to myself, vitamins, what would be the downside to taking extra vitamins?
Yeah, well, actually, some vitamins can cause symptoms like constipation or nausea, and then you end up having to take another medication to treat that symptom. So there are some vitamins like iron and calcium that we can reduce the daily dose or the number of times you take it per week, and you might have fewer symptoms like gastrointestinal upset.
Boy, the things you learn. All right. I wish we had more time. I thank you so much. Very much appreciate the time today.
Yeah, thanks for the conversation. Yeah. Take care. Bye.
You bet. You too, Dr. Emily McDonald over at McGill. Worth considering, right? I think, and I remember my mom, God bless her, towards the end of her life, it was taking a ton of pills. You know the old story about you have pill boxes now to know which ones to take on which day of the week, that kind of thing. And clearly there needs to be, maybe I used the wrong word when I said there be pushback to your doctor, but you know what? It's kind of incumbent upon you if you find yourself or a family member in a situation like that to simply ask the question. Because as she just said, you're certainly not doing yourself any good by taking these pills and not understanding what they're for, just taking them forever when they're not designed to be taken forever. So I'm glad. I hope this study gets more attention.
Close your eyes and you can hear the entire world come alive. 2026 FIFA World Cup is on, and you can stream it all live on TSN Radio. From the opening kickoff to the final celebration, every match, every moment. Listen to FIFA World Cup on TSN Radio.
Gives Canada the lift off.
Available on iHeartRadio.